Sunil Jangid. Today I will talk about blood flow restriction training or BFR, or a rehab tool that helps people build strength with very lightweight. I picked this because it's practical, a little surprising to people at first, and really useful in rehab settings. Purpose of the tool. Okay, so what is BFR? It's simple in idea, like we put a cuff or band on the limb to partially limit blood flow while someone does low load exercise. Okay, that restriction creates a stress in the muscle that makes it respond like it's lifting heavy, even though the actual weight is low. That's why it's greater after surgery or for anyone who can't handle heavy loads. History and background. BFR started in Japan decades ago. Katsu is where it began. And over the past 15 to 20 years, it's moved into clinical practice. Researchers and therapists have been refining how to use it safely. And now there are guidance for pressure, frequency, and who should or shouldn't use it. Slide. How it works. Okay, let me explain you in short without getting too technical. Restricting venous return causes metabolics to build up in the muscle that signals that signals the body to recruit more muscle fibers and turn on growth pathways, so you get strength and hypertrophy gains even at 20 to 30% of your 1 RM. In plain terms, like your muscle thinks it's working harder than it actually is. Clinical use. In the clinic, we use it for post operation patients, people with painful joints, older adults, or anyone who needs strength but can't lift heavy. It prevents atrophy and keep them progressing while protecting healing tissues. Slide 6. Key research findings. Okay. Research strongly supports BFR as an effective rehab tool. Okay. Several systematic reviews and meta-analysis shows that low load BFR training can lead to similar strength and muscle gains as traditional high load resistance training. It also shown benefits in knee osteoarthritis and post operation recovery, improving both muscle functions and endurance. The key point, like when BFR is used correctly and supervised, it's not just effective, it's safe and evidence based. Okay. Safety and contradictions. Okay, that said, safety always comes first. Minor side effects can include temporary discomfort or muscle soreness. Okay. Serious events like blood clots are very rare when protocols are followed. However, BFR shouldn't be used for patients with uncontrolled hypertensions, active thrombosis, or open wound near the cuff areas. So proper screening and monitoring are essential before starting BFR therapy. Okay, slide 8. Practical application and protocols. Like in practice, we don't just guess the pressure, we use as individualized percentage of limb occlusion pressure or LOP. Like typical training is done at 20 to 30% of 1 RM, following a set structure like 30 reps, then 15, 15, and 15, with short rest in between. Sessions are usually 2 to 3 times a week. The cuff stays inflated during each set, then released after. It's simple, time efficient, and very adaptable to patient needs as long as it's properly supervised. My experience with BFR training. Okay, so from my own experience using BFR during clinical sessions and coursework, I have seen great results, especially with lower limb rehab exercises like squats and leg extensions. Patients often start a bit skeptical, but once they understand how it works, they usually find it motivating. I have noticed improved strength and confidence without increasing pain. And the key factor for success was monitoring the pressure and providing good patient education. It's a unique mix of challenge and safety that makes rehab feel productive again for many patients. Now, slide 10. Okay. My overall, my overall take is to endorse BAFR training, but with caution. It's an excellent tool for rehab professionals who understands the science and use it responsibly. It's not a one size fits all approach, and it shouldn't replace traditional training, but it's a great adjunct method to help patients rebuild muscle safety muscles safely and efficiently. Okay, these are a few key sources I used, including Fretex ET established in 2021 and others that highlights both effectiveness and safety of BFR in clinical setting. Okay, so wrap up before, like, BFR is one of those tools that shows how smart evidence-based methods can make rehab more efficient and accessible. It helps patients who can't do heavy lifting still make real progress, and that's what good rehabilitation is all about. Thank you for listening, and I will happy to answer any questions.